Good day to all. This is Divya, a 12th grader here at the NGP school, ready to interact with an expert. The modern age comes with many new technologies and techniques. Many branches of science have popped up, and with these, we have found so many new ways to cure a disease. Of all these different discoveries, one of mankind's best invention is radiology, which has truly transformed the way we diagnose a patient. Do you want to find out more about radiology? If yes, then continue watching this video. Now, first off, I want us all to imagine a doctor faced with the predicament of needing to treat a patient where the patient seems fine on the outside. Imagine how amazing it would be if the doctor could see all the internal organs of the patient without needing to make even a single cut on the patient's body. This is possible if you apply radiology. Think about a mother's smile when she sees the image of her developing baby for the first time. Or picture out a patient who has been diagnosed with breast cancer. They might be feeling horrible that they have this disease, but yet there is a ray of hope that it can be cured thanks to early detection of the disease. Again, thanks to radiology. Whether you're talking about magnetic resonance imaging, computer tomography, or any other radiological procedure, we can all agree that radiology has immense importance. If you still don't believe me, then did you know that scientists were actually able to crack behind the real reason of the death of King Tut? Who was King Tut? Well, he was a 3,300-year-old ancient mummy, and his death was a mystery that was solved only because of computer tomography. Incredible! Now, with such an amazing invention comes the need to celebrate it, and today is that day to celebrate it. Today, November 8th, we celebrate International Day for Radiology. Here I have with us Dr. Matthew Cherian, MBBS, MD, and PDC on the NGP Talk series. Now, can we start, Doctor?
Divya, thank you so much. It's a pleasure being with you. Go ahead.
Thank you, sir. I would like for us to first know more about our guest. Let me introduce our guest, Dr. Matthew Cherian. He was a university gold medalist in radiology, and his association with KMCH started in 1991 when he started working as a consultant in radiology. His special area of interest is in neuro and vascular interventional radiology. He is a member of not only the Indian Society of Vascular and Interventional Radiology, but also for the European Society. He also contributes his knowledge and expertise as a peer reviewer for USA, India, and Europe's journals on vascular and interventional radiology. Dr. Matthew Cherian also proctors in neuro and vascular intervention in Malaysia, Indonesia, Thailand, and Sri Lanka. Doctor has delivered more than 100 invited guest lectures, and he was the president of the Indian Society of Therapeutic Neurointervention. Amazing to know your journey, sir. It is a great honor to have you here. Now, with no further ado, let's begin. Doctor, can you start off by giving some insights on what exactly radiology is?
So, like you introduced the topic, radiology is about imaging the body. And when we talk about imaging, we actually look right inside the body from head to toe. So when Röntgen invented X-rays, he probably never even dreamt that we would come this far. He had taken X-rays and he thought he would be just seeing bones because that's where X-rays ended by the time Röntgen had died. But today, thanks to technology like computerized tomography or MR or ultrasound, we can actually see the soft tissues, we can see blood vessels, We can see bones, we can see just about any part of the body. So that in a nutshell is radiology. And the word radio actually is a misnomer now, because when Röntgen started X-rays, it was associated with radiation. But today we use other forms of energy with no radiation at all. But we still call it radiology just to remember the people who actually started it. I'm sure you know that Röntgen got a Nobel Prize for this discovery because at that point of time, it was astounding. And Divya, are you aware of the fact that people wanted to burn him down? Because they thought that, give them X-ray glasses and you can probably see through the clothes. It was such a novel discovery that it really, really created waves. And of course, like everything, a lot of false propaganda. But finally, I think it was a cornerstone invention which could change the way we treated diseases.
Thank you, sir. That was interesting. Now, it is true that lots of time people react badly to really great inventions without realizing how important it is at those times. Now, what are the various types of screening or imaging that a radiologist does?
Okay. So, one simple way of understanding it is dividing it based on the energy that we use to screen. So we've got a subset of machines that use X-rays. And like the most basic one is the standard X-rays, where we would pass X-rays across the body and we would see the chest or the bones and we would say that is there a fracture or maybe some gross problems. But minute diseases can't be picked up. Divya, you'd be shocked if I tell you an X-ray just shows you 25% of the lungs.
Oh.
If you look at it, when I take an X-ray, I don't see the part that's behind the bones. So imagine 50% of the front is a rib and a space. Then we got the space or the area that is touching the heart. So that's another 25% gone. Then the part that is sitting on the diaphragm is another 25% gone. So imagine trying to give you a diagnosis where I actually see just 25% of the organs. So obviously, X-rays did not give us all the answers. So a little later down the line, it was a scientist by the name of Hounsfield who started using X-rays to reconstruct images as though you were cutting through them. And that's the invention of computerized tomography. Do you know the place where they first invented CT scans was the EMI laboratories. And EMI was the place they used to make music records. They had a very interesting philosophy. And the philosophy was, why don't you try to experiment on something that's totally different from what we do? So right at the EMI laboratories in the United Kingdom, Hounsfield came with this concept that we can see the cross-section of the body. And he too got a Nobel Prize. It was astounding, right? So the second thing is CT, where we can see from head to toe in sections. Now, this was huge. For the first time, we could see a brain tumor. Divya, before that, we take an X-ray, you got a headache, we presume you got a brain tumor. We open up the brain, we don't even know where they are, and most of the people will die. Now we know the exact location. And then what's beautiful about this is today we link this image to a navigating robo, and that directs the instrument precisely to the spot that you work. So talking about energy, let's now come to ultrasound. Now, what is ultrasound? Ultrasound is sound that is beyond the audible frequency. That is more than 20,000 cycles. But in diagnostic ultrasound, we use much higher frequencies. Now, ultrasound can be done for any part of the body provided there's no air. So it's not a great tool for the lungs, can help, but it's very good for the abdomen, very good for the uterus, very good for seeing the baby, very good to see the soft tissues. So the other tool that we use is ultrasound, and the big advantage of ultrasound is it does not have any harmful rays. Then we use another very fascinating tool, which is called MRI. It's magnetic resonance imaging. It's so different from anything because we actually excite the nuclear in the body. They will finally give back a kind of radio frequency or energy which will give us tissues. And this gives exquisite detail of the soft tissues of the body. So these are the three main areas of work. I forgot to talk about mammography, which is another tool we use. It basically uses X-rays again. Then another tool is we inject an agent which generates energy, which are called isotopes. So we have got the gamma cameras and the PET scanners, which actually starts radiating and we take an image out of it. So that kind of gives you an idea about the things that we can do in radiology today. Like I said, it's based on the energy and we can talk the whole day about it.
Wow, that is really interesting, sir. Now, another question. Suppose a radiologist has to scan both a cancer patient and a cardiac patient. Can the same radiologist do it, or are there any specializations?
I don't know, Divya, how you came up with this question, but this is what the world has realized. It's not possible anymore for the same radiologist to specialize in all areas. It's just like medicine. First, we had a general physician. Then we said, that can't work. We need a medical guy and a surgical guy and a gynecologist, right? So that started happening and we started going more and more of less and less. I don't know if you heard this joke, but they say today, if you have a cold and it becomes a pneumonia, you got to change your doctor, right? Because we changed the area. So today, do you know that we thought about it way ahead of anybody else in the country? And KMCH is the only private hospital in the country where we have already subspecialized. That's why I asked you, how did you ask this question? So we got a lead consultant. I practice interventional radiology and I got a group of doctors who all work, and inside that group we subdivided again. I work mostly on the brain. I got another colleague, Dr. Pankaj Mehta, who works on the blood vessels of the leg, and another colleague who works on the liver. Same way, we got a doctor who works on the heart. His name is Dr. Pudyawan. So another doctor, Dr. Rupa, who just does the breast and the female pelvis. We got another group headed by Dr. Sumati, who just looks at pregnant women and the fetus. We got another doctor by the name of Sita Ram, who just looks at joints. And same way, we got a doctor for oncology. We got a doctor for the brain. So that is called subspecialization. And without any doubt, the future is in subspecialization because knowledge has become so big, we use so many instruments, and it's technically not possible to give you a great diagnosis unless you know everything about it.
Wow, that is really interesting to know. Doctor, I also want to know that I've actually heard from lots of news and science magazines that radiation is really hazardous to the human body. And yet here we are using it, right? So what exactly are the precautions that the doctors and patients are doing in order to ensure that it doesn't harm the body?
You know, it's a huge question right now. Radiation is harmful. I don't know if you had a chance to watch this movie. It's called Radioactive. Oh, it's a movie on Marie Curie. And you would see at that point of time, Marie Curie was the person who actually discovered radium. Now, what happened is she and her husband both died because of radiation exposure. They had absolutely no clue. They never knew this was so bad. But at the same time, you have to understand the dose of radiation that we use in diagnostic procedures is really low. But that doesn't mean we can abuse it. We have to be careful. But it's not dangerous enough to produce cancer unless I take a kid who's growing up and do 100 CT scans on him. Yeah. So the doses are really low. Then you ask this question, how do we protect ourselves? We actually are careful. We use a kind of a clothing which has got tin which protects us from X-rays. which is kind of 0.5 thick, and we have 2 layers of that. We also ensure the machines have devices that protect us. So we're kind of very careful about it. But you're right. X-rays are dangerous, but I told you, ultrasound isn't, MRs isn't. It's only with X-rays that we have a problem.
Thank you, sir. That was informative. Yeah. Do radiologists also perform surgeries?
So, Divya, you're right about that. Radiologists do perform surgeries. It was Charles' daughter who invented or coined this term called Interventional Radiology. So it's about doing procedures through a small pinhole. So if you open a block in a blood vessel, we call it angioplasty. If you block a blood vessel, we call it embolization. And you can ask, why should you block a blood vessel? Now, for some example, somebody's had an accident. He's bleeding profusely from a blood vessel from a fracture in the pelvis. We go ahead and block the bleeding vessel and he saves his life. Do you know there are so many women who die after delivery because they continue to bleed? It's a cause of death. We block the blood vessel, and do you know hardly any woman has died in our hospital because of bleeding during pregnancy, because we block the blood vessel. In the same way, we do procedures in the brain. After a bleed, there is a vessel that is ruptured. We go and fix it up. It's called treating an aneurysm. Do you know there is a procedure even to block the blood supply to the fibroid in a uterus, and the fibroid will shrink? We have got colleagues in the fetal side who look after the fetus. They do procedures for pinhole in the unborn baby itself. That's as fascinating as that. I got a colleague who works on the breast area. She takes out tumors of the breast without surgery through a pinhole. So there's a whole lot of procedures we do. And if you give me an opportunity, I can talk the whole day about the things we do through pinholes. And we feel they are the most amazing procedures because they never ever produce a scar.
That is really fascinating, sir. Thank you. Now, I want to know, do those regular screening tests like you have X-rays, ultrasound, CT, as you said, does it require a trained professional or will any other radiologist do?
All radiologists are trained to do these procedures because that is part of the curriculum that we do. So if you talk, a kind of a reasonably decent job can be done by any radiologist. But if you want to go really, really deep into it, find out more complex diseases, we need to specialize. But all radiologists, by the time they pass the exam, they have a pretty decent idea about ultrasound, CT, MRI, and X-rays. They may not know much about interventional radiology because those are procedures that we actually do. But definitely the rest of it is always there.
Thank you, sir. Now, one last question. 10 years from now, how do you envision this branch of science to have evolved? Do you think that there will be newer, more accurate techniques? What exactly are your thoughts, doctor?
So, Divya, I'm going to ask you this question. Yes. Where do you think this world is heading for?
AI. Probably, I'm thinking that we're going to find completely new branches of science, and in radiology itself, there's probably going to be ways where without a doctor, maybe a robot itself can do it.
So you are perfectly right. So AI is going to play a big role. Is there anything else you think? You use the word robo also.
Robotic surgery.
Yeah. So imagine, you got to think about robotic surgery. So you are so close to this amazing fact that artificial intelligence will help us in reporting in a huge way. Do you know that during the peak of COVID, we had to do 250 lung scans every day? Wow. And we would do it in the night so that these patients don't cross-infect the other patients in the hospital. So from 10 o'clock in the night to 12 o'clock in the night, we would do 250 scans and we report all of it in 1 hour. And how did we do that? Because of AI. Because the system would screen through the X-rays and tell us this is normal, this has got so much percentage of the lung involved. We just had to confirm the diagnosis. So definitely AI is going to play a big role in medicine overall and radiology. So does that mean we're going to lose jobs? No, definitely not. What it's going to do for us is you can efficiently use your time. You don't waste your time looking at normal scans because it all get cleared. You just see the pathology and it tells you there is this tumor in the liver. It looks like liver cancer. Can you confirm it, right? So there's going to be this whole change that takes place when we become a lot more efficient. At the same time, we are now going to use them and take all the information that I have from these imaging tools and then couple this information into navigation tools. And then we start doing computer-aided or robotic-aided surgeries, which makes things much faster and more precise. So both these combinations will play a great role. You may see some specialties actually coming down, but other specialties going up. Divya, can you just imagine for a moment and think which specialty do you going to think is going to really boom in the future?
Radiology.
No, it's psychiatry.
Oh, psychiatry.
You know what? Something? All the technology doesn't make us happy.
Oh, that is
I don't know. Why? I think we are more lonely in the end. Facebook friends are not like real people. So I think the projection is we're going to see more of depression, more of anxiety disorders, more issues like this. And these are things that will grow much more. And the other area we're going to see a huge growth is in artificial robotic limbs. You have an amputated, you've got a bionic arms that will come up. They are very precise. As you think, the arm starts moving. So on one side, you may see a shift taking place. On the other side, you see a huge development. Radiology will change, I agree, to a great extent. Right now, each of the radiologists in my department, they do about 30 or 40 cases of routine. It will go up to 100. It's so efficient. And I'm working with a young group in Coimbatore to see whether we can make ultrasound scanners perform ultrasound without a human close by, so that we can place it in very remote areas. So there's a lot of exciting things happening. And the future is exciting, but lonely.
Yeah. Okay.
So remember this. Real friends are real friends. Virtual friends can never make up. Psychiatrists will boom because technology finally does not make us happy people.
Okay. Thank you so much. That was really incredible, sir. And thank you, doctor, for all of your valuable responses. Our audience probably learned as much as I did today. It was a great opportunity. Thank you. And thank you, viewers, for having stayed tuned in. If you like this video, then don't forget to share, subscribe, and give us a huge like button. Thank you.
Thank you once again, Divya. It was sheer pleasure being with you. And that was a fantastic interview.
Thank you, sir.